Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, The Impact of Reirradiation of Painful Osseous Metastases on Quality of Life and Function, a secondary analysis of the NCIC SC.20 randomized trial by Edward Chow et al. My name is Joseph Salama, and I'm an associate professor at Duke University and chief radiation oncology service at the Durham VA Medical Center, both in Durham, North Carolina, USA. My oncologic specialty is radiation oncology. In this article, Chow and colleagues report a secondary analysis of the NCIC SC.20 trial describing the significant potential for improved quality of life that a second course of radiation can provide for patients with previously irradiated painful osseous metastases. To review for listeners who may not be familiar, NCIC SC.20 was an international multi-center non-inferiority randomized trial in which adult patients with painful previously irradiated osseous metastases were randomly assigned to one of two reirradiation schedules, a single fraction of 8 gray or 20 gray in multiple fractions. The primary endpoint was overall pain response at 2 months, assessed by the International Consensus Endpoint, which combined the commonly used brief pain inventory with changes in narcotic analgesic consumption. The results of NCIC SC.20 were reported earlier this year. In the intention to treat analysis, the difference in overall pain response was less than the pre-specified non-inferiority margin of 10%, indicating no detectable difference in pain relief between the two reirradiation schedules, with less acute toxicity in the single-dose arm. Those that received protocol treatment had a pain response in approximately half of the cases, irrespective of the pain response to the first course or fractionation of radiation. Furthermore, no difference in global quality of life at baseline in 2 months was identified between treatment groups. In the current report, the NCIC SC.20 investigators used data collected during the trial to answer a very important additional question. Can reirradiation as a treatment for painful osseous metastases not only relieve pain, but do so to a degree that patients' functional activity and quality of life are improved? This question is clinically relevant as some oncologists doubt the benefit of a second course of radiotherapy to a painful osseous metastasis, particularly if it did not respond to a first course of radiation. Furthermore, some radiation oncologists are reluctant to give a second course due to concerns that additional toxicity will outweigh the potential benefit. To answer these questions, the authors pooled patients on NCIC SC.20, irrespective of treatment arm, into two groups: those that had a pain response to a second course of radiation as determined by the international consensus definition, and those that did not. This was possible as prior analyses had demonstrated that the randomized radiation dose schedule had no impact on pain response. The authors then compared the changes in function and quality of life from baseline to 2 months after reirradiation. Functional status was assessed using the Brief Pain Inventory Functional Interference Tool, a series of questions assessing general activity, mood, walking ability, normal work, relations with other people, sleep, and enjoyment of life scored from 0 to 10, with lower scores indicating better function. Clinically meaningful changes were defined as a difference of 2 points. Quality of life was assessed using the EORTC QLQ-C30, a questionnaire containing 5 multi-item subscales: physical, role, emotional, cognitive, and social functioning, 6 single-item symptom scales, including sleep disturbance, constipation, diarrhea, dyspnea, anorexia, and financial issues, and 3 multi-item symptom scales: fatigue, pain, and nausea, as well as global health status scale. Clinically meaningful differences in quality of life were defined as changes in 10 points. Of the 850 randomized patients, 528 patients from the intention to treat analysis were evaluable, with 253 responding to a second course of radiation and 275 not responding. Responders and non-responders in general had similar baseline clinicopathological characteristics, although the median oral morphine equivalents appeared to be numerically lower in the responders than in other groups. Baseline pre-protocol functional status, as measured with the Brief Pain Inventory Functional Scale and Quality of Life, were similar between the groups. However, those that responded had greater enjoyment of life, better ability to have normal work, were more likely to have better role functioning, social functioning, and less constipation, with trends for improved ability to walk and improved cognitive functioning at baseline. There were also trends for worse fatigue, nausea, and financial status in non-responders at baseline. Following treatment at the 2-month time point, those who responded to a second course of radiation had clinically meaningful and statistically significant improvements in all 7 functional domains of the Brief Pain Inventory, as can be seen in Table 3 of their paper. These were significant whether analyzed as a mean change in score from baseline or as the percent having a clinically significant improvement of functional status, as shown in Table 4. Similarly, as shown in Table 6, at 2 months, clinically meaningful benefits were seen in physical, role, emotional, social, and global quality of life functioning. Furthermore, responders were more likely to exhibit clinically meaningful improvements with less fatigue, improved appetite, and of course, reduced pain. Benefits were similar if the Brief Pain Inventory alone was used, although clear discrimination between responders and non-responders was seen with the international consensus definition. Therefore, the authors rightfully conclude that a second course of radiation for painful bone metastases can be associated with meaningful improvements in quality of life and function. These data and a prior SC.20 report augment the role of radiotherapy for painful osseous metastases by demonstrating that a second course of radiation has a meaningful success rate in reducing pain, whether or not the original radiation treatment was able to. Those that respond to a second course of radiation have significant improvements in functional independence and quality of life across all measures. Furthermore, as those not responding did not have significant decrements in quality of life, these data help alleviate the concerns of significant acute toxicities from a second course of radiation. Multiple randomized trials of de novo radiation for painful osseous metastases have demonstrated a greater willingness to offer a second course of radiation for bone metastases following a single dose course compared to a multiple dose course. The data presented here by Chow et al. Demonstrate that for all patients with recurrent pain or inadequate pain relief following an initial course of radiation, a second course of radiation is associated with low toxicity and meaningful improvements in function and quality of life. This is important as patients not responding after irradiation of a painful osseous metastasis are often continued on further opioids, which in addition to reducing pain, can significantly alter quality of life with constipation, decreased concentration, increased drowsiness, in addition to decreased functional ability. This analysis and the previously reported outcomes analysis of SC.20 give oncologists strong evidence to offer repeat radiation as a tool to help our patients maintain functional independence as long as possible and enhance their quality of life, often in their time of greatest need. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.